A lot of Zoomers might spend more time inside, certainly in the winter, of course, but also in the summer, and therefore may not be able to make as much vitamin D, because we make vitamin D when the UVB rays from the sun interact with a cholesterol compound in the skin, and we start the whole process of making active vitamin D in the body. But we need to have the sun at a certain altitude in the sky in order to do that. And in winter in Canada, we can't do that, really between essentially October and May. So we need, if we're going to store vitamin D from our skin and make it that way, then we need to be exposed as much of our body as possible to the sun in the summer months in order to store it for the winter months. But our production of vitamin D, it has to go through the liver and the kidney, and that's a very complicated process in the body. In a Zoomer population, there's increased potential there because of certain nutrient deficiencies or insufficiencies, that some of those processes might not work as well. And that's where supplementation might benefit a Zoomer population. For a good vitamin D supplement, you need to make sure that it's D3, which is also cholecalciferol. So you want to make sure that it's that. A lot of times you'll see vitamin D, it'll just say vitamin D, so you really want to look at the ingredients listing and make sure it's D3. As far as how much, that's going to depend on your relative insufficiency of vitamin D. Health Canada, I believe, recommends between 200 to 600 international units a day, or IUs a day. The Canadian Cancer Society would prefer to see it at around 1,000 IUs a day, and many researchers are now saying that that is probably insufficient as well. And that brings us to the question of toxicity. Is there a toxicity with vitamin D? It was thought forever that vitamin D in large doses was very toxic. There are no studies to support that, actually. There are studies in some animals to support a toxicity levels that we could never take in, even in supplementation. So reaching a toxicity is very difficult. Supplementing at low doses may not be enough to get your blood level to the place where it needs to be to benefit from the immune effects of vitamin D. So it may be that the 2,000 IUs is in fact too low.